most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how strong butt muscles, the glutes,
Ooh.
can actually help your hip pain. How to test it, and we're going to show you today how to test your butt muscles to see if they're weak, especially the glute max.
Right, that maximum is it's glute max for a reason, Bob.
Yep. So all the gluteus muscles, there's three of them.
Yep.
Gluteus medius, gluteus minimus, gluteus maximus. They all stabilize the hip. They all hold it, help hold it in the socket. They also move the hip
Right.
in a certain direction. But what happens is if it's not doing its job, they're not doing their job, let's say they're weak, especially the glute max. The glute max stops the hip from sliding forward and hitting that socket there. And right inside here is the labrum. So it can actually end up squishing that labrum,
Ooh.
helping it tear.
Yep.
So you really don't like to have this happen. This happened to me. I didn't know what it was at the time. And I was really what you call hamstring dominant. I wasn't using my glutes when I was running. And I was getting pain down in my hip and down the front of the thigh.
Sure.
And it was to the point where I had to stop running. This happened to me twice.
Yeah.
I mean, I had to take off running for like a month.
Ooh.
And so it's
no good.
Yeah, so you really, and once I've started changing my gait,
Mm-hmm.
changing my running pattern, and started using my glutes more, it kicked in and it doesn't give me any trouble
Sure.
at all now.
Yep.
So all right.
All right.
He doesn't have a leg to stand on there, does he? All right, so we're going to show you 3 ways to actually test your glutes, maybe even 4. So this is also called glute amnesia.
Oh, that's right. Yes.
So,
in other words, they don't fire and they weaken.
yeah, and this is very common in our society today, unfortunately, because we sit a lot,
Mm-hmm.
and the glutes weaken, and the hip flexors can tighten. And that actually, remember the term reciprocal inhibition?
Yes,
So,
I do, Bob.
yeah, it means that like if one muscle is firing on one side, the other side is going to be inhibited.
Right. They work together, and sometimes for the better, and in this case, for the worse.
Right. So let's do the first one. It's called the chair of death. Brad's going to bring that chair over.
Yeah, don't get too excited. It's just a name. It's really very pleasant.
So you're going to put the chair right in front of your knees like this. And what you should be able to do is you should be able to stand up without pushing the chair like that. It means your butt muscles are kicking in. If you don't, you're doing more quad like this and having to lean forward. Yeah, you're more quad dependent and your butt's not working like it should.
Right. It just isolates those glutes. So
Right, makes them work a little harder. All right, the next one, Brad, do you want to show this?
Which one?
The
prone?
The prone one.
Yeah, I'll do that.
I'll move this out of the way. So you can either have someone do it for you, or because it's kind of a sensitive area, you might do it yourself. But I found if you can just put your hand on your butt and your hamstring at the same time, and what you do is you lift the leg up, and what you're trying to palpate or feel is whether or not, which kicks in first, the butt muscle or the hamstring.
This one for the layperson, because you may not be familiar with your anatomy as well, but my fingertips right now, that's my hamstring, and my palm is on my glute max.
Right.
And so right there, if I took my clothes off, it'd be easier, but I'm not that kind of person. I can feel my glute kicking very clearly with the palm, the heel of my palm, and...
Are they kicking at the same time?
Well, my glutes are first. And I've done this on the floor with a hard surface. And
yeah, you said it's easier on the floor.
It was versus. Yeah. So don't do this on the floor versus your bed if you have.
Yeah. Now, if you find out one that doesn't even feel like your glutes kicking in, or compare sides, or 2, it's actually kicking in way after the hamstring. Then you're pretty much hamstring dominant, and that was me for many years. All right, the last one. Well, Brad, I'm gonna have you lay down.
Oh,
first.
do the 90-degree one.
Yeah, so this is the one you can do, hey, you need some help doing. And Brad's supposed to lift his foot to the ceiling, and I'm going to push on that at the same time. Now, if that just gives way, again, you can compare the sides. Lift up, um, then it's weak. That's measuring the glute max. The other one that Brad had mentioned, I thought was a good idea, is do a single leg bridge.
Okay, so this is a bridge. It works the glutes. I'm got both feet flat. I'm going to lift one up and just work one leg. And on this one, you're really going to compare. It's a good comparison right to left. You notice
Well, one, if you can't get up,
well, yeah,
with
exactly.
one leg,
Yep.
your glutes are weak.
Yeah.
So, and that's going to be some people, Brad. They won't be able to lift their
exactly.
butt up. So, that's it. If you check out our next video, we're going to show how to strengthen the glutes.
Yep.
Actually, our next couple of videos. These are all part of a series of videos on treating hip pain. And you go to bobandbrad.com, go to the program section, look for the ones on hip pain. Watch only ones you need to watch, the ones that
Right.
pertain to you, because there's a lot.
Right.
And also, Brad,
PDF printout of summarizing the whole video with the exercises on print. It's a really good deal. We don't even ask for your email. All the videos are around
They're
10
all
minutes
free.
long and free. It's a gift.
all right. Thanks for watching.